Dr. Niedzwiecki works on the process through which social policies are formed and implemented in Latin America and beyond. She also studies the territorial structure of government with an emphasis on the measurement of the authority of regional governments across countries. Her book, Uneven Social Policies, The Politics of Subnational Variation in Latin America, came out in 2018. Dr. Niedzwiecki's talk today is titled The Politics of COVID-19 Responses in Latin America. Sari, over to you.
Thank you, and thank you for the invitation. So today I'll try to make some sense of how a single challenge, COVID-19, produced so very different responses, government responses in the largest federations in Latin America, Argentina, Brazil, and Mexico. COVID-19 is rapidly moving to Latin America. The pandemic in Latin America lands in a context in which a majority of the population work in the informal sector. What that means is that these people are not able to collect unemployment. And these countries also have an absence of massive testing capacity, and therefore lockdowns and shelterings in place have been the main containment response. But of course, you cannot expect people to stay at home if what that means is that they will not be able to feed their families. And so in this context, with my co-authors, we're looking at three particular government responses in terms of lockdowns and income replacement policies because of the relationship between the two. So Argentina has offered the most rapid and comprehensive reform. The government has ordered from the very beginning, after the first case was identified, complete and early confinement of the population. And this is controlled by the police. That means that non-compliance, if they see you walking in the street, is prosecuted as a criminal offense. All schools, malls, restaurants, but also interregional public transport is prohibited. The government has also implemented a relatively generous social policy response, giving everybody who has lost any income a transfer of $150 per month, and also increases in the main social assistance program. Brazil is perhaps the main infamous case that is discussed in the US. There's no national quarantine nor lockdown. Most states, such as Sao Paulo, have responded with some sort of confinement measure precisely because of the absence of national lockdown. However, the part that is less spoken to in the media is about the role that the opposition has had in Congress, the left party, the Workers' Party in the opposition, passing a relatively generous income replacement package that includes informal workers, that's $120 per month, and also expansion of the main social assistance program. It's called Bolsa Familia. And Mexico has offered a mixed response. There was originally no national lockdown. It took the government of López Obrador a long time. And as the infected cases increase, Mexico has been tightening the restrictions. But the truth is that on the ground, states and municipalities have some leeway in interpreting the social distancing measures. And Mexico also has only implemented a meager income replacement program in amount and coverage, as it only covers the elderly and the disabled. And so in trying to make sense of these differences across cases, the main response that we found with my co-authors is the characteristics, the individual characteristics of the president. And there's absolutely no doubt that this is a central factor. There are responsible leaders that recognize science and they will implement more comprehensive responses. And then there are populist deniers in Latin America, and so that matters. But our idea in this recently co-authored piece is to move beyond the individual characteristics of the president and try to understand institutional factors that can be generalized to other countries. We analyze in particular three factors that for us matter. For time constraint, I'm only going to analyze two. The first one is in political science, a concept that is understood as the rootedness of political parties. Rooted parties, like parties in the US, for example, have been around for a very long time. Voters have a very strong party identity. They always tend to vote for the same political party. And so we see differences across the three cases. In Argentina, the party of the president is the Peronist party. This party has a very long-lasting identity. It has been able to maintain support among low-income voters. And this is very important because this support gives the president leeway to enact a nationwide lockdown in spite of the big economic costs that that lockdown is going to have for the country. Bolsonaro in Brazil has changed parties 9 times. He campaigned on an anti-party platform. And the vote of low-income voters is actually disputed with the left-wing Workers' Party, the party of the opposition. This means that the president does not have clear support of the sector that will be the most affected by lockdowns. And finally, Morena, López Obrador's party in Mexico, is younger than the Peronist party. And importantly, the vote of vulnerable sectors, the informal sector, is disputed between this party, the PRD, and the PRI. And then the second variable that for us helps us understand why social policy packages are more generous in Argentina and Brazil compared with Mexico are the legacies of a strong welfare state. Argentina, Brazil, but also Chile, Uruguay, and Costa Rica exhibit the strongest social policy regimes in the region. This means that Argentina and Brazil in particular can build on already existing generous social programs that allows them to expand very quickly in response to COVID-19. But Mexico doesn't have that level of development of the welfare state, and therefore the response has been more limited. Importantly, these policy legacies, as my own previous research shows, is supported by powerful actors such as unions and social movements. So failing to expand social policies in countries with more developed welfare states will generate for sure a strong opposition from these organized forces, especially in a context of crisis. Of course, this all matters because the policy response has a direct influence on the number of cases and deaths in these countries so far. So, presidents' views, interests, decisions, how much they believe in science or not, have been decisive for Argentina, Brazil, and Mexico. But an institutional analysis that considers parties and welfare states, we argue with my co-authors, is also critical to understand why the reaction to a common challenge has been so different in these three countries. Thank you.